My name is Michael Bischoff, and I was diagnosed about 4 months ago with glioblastoma, an aggressive kind of brain cancer.
I'm Peter Lund. I am a primary care physician at Abbott Northwestern Hospital in South Minneapolis.
Peter and his team of residents became my primary care clinic right at the time of my diagnosis.
We've known each other casually for years because our kids know each other. We've walked a lot of this path together of getting information, being fearful for what the information might mean, having those fears confirmed.
Peter has been a compassionate companion, helping research and interpret and integrate a lot of different information. A few days after I found out I had a tumor, I was in the neurosurgeon's office, and it was all still very new to me, and the surgeon recommended that we do surgery in 2 days to take out the tumor, which seemed like maybe that's good, but it was freaky and seemed very quick. And so my wife had called Peter's office, and then Peter came to the neurosurgeon's office 2 minutes later. And it just made all the difference in being able to take in the information, to process the recommendation, and have the reassurance from Peter, yeah, that's a good thing to do. It's important to do it quickly. This is an opportunity to take advantage of. And already have the relationship with Peter and be able to help that trust bridge the trust with the neurosurgeon who I just met minutes before that.
What our goal is that, yeah, if you don't know who to call, you call me. If I will check in with you. I think that's a role that in primary care that too many people give up on, both the doctors and the patients do. You become focused on your, in this case, oncologist, in other cases, transplant specialist or whatever. But I have something that they don't have, which is a longer relationship, and also I have time.
When I was deciding between two major treatment options, one of them was a clinical trial with a new vaccine in a phase 1 early trial. Had a lot of promise, but a lot of risk. And another one was wearing this science fiction kind of device that generates an electric field that's purpose is to prevent the cancer cells from duplicating. Both of which were very confusing and overwhelming to me. Peter and his team were right there with us to proactively research. Here's what this means, interpret that, what it means, and decipher a little bit of the agendas of the different doctors and clinics we're working with.
A little bit using your power as the primary doctor. You can just call people and they'll talk to you, and you can break in and say, hey, I need your time. I need a little bit more information here. My patient's having a hard time making a decision. So I was able to have a personal conversation with the other people in the situation.
So I did go with the science fiction cap called Optune, and it was a hard decision and hard choice, made much easier by Peter's research and interpretation and recommendations.
When we hear bad news, our brain, all of our brains, shut down a little bit, and so we need someone there to help to reflect things. After the visit, I think it's nice to circle back with your provider and then try to make a real decision about what do I need to talk to my provider about, and how could I best use my provider's team so that I get the most out of our interactions, but that remembering that almost every doctor is part of a care team, and a lot of those questions and reiterations can also come from a team.
I have done a lot of integrative therapies like Qigong and Healing Touch, and gone to a naturopath and gotten advice about diet and supplements, and really believe in prayer and community as a part of my treatment as well. I mostly haven't asked Peter for advice about those things, but he knows about some of them, doesn't about others.
Yeah.
And I felt general support, while with sometimes his caveat about we don't know what data there is about that, and his focus is on wanting to be as based in data as possible, which I respect. In contrast with some of the other physicians I've worked with, I've experienced what I would say is kind of a hostility towards anything else beyond the formal treatment.
My beliefs as a physician are that being touched is good. And so my patients who seek care that I do not have the data to support or refute, I am in general supportive of people seeing practitioners and having conversations about being well. And I am supportive of people having human touch in their lives, which many of my patients don't have.
My approach to dealing with the cancer draws on a lot of spiritual practices and roots. And I think Peter's known that and respected that, although that's not the main topic of our conversation. But I have felt a lot of respect and appreciation for that from Peter, even if it's not something that we're doing together.
In primary care, we get asked about faith and all of these things, and I'm usually fairly guarded on that subject. It's not, but it's been a very eye-opening and wonderful experience for me, just as a person, to incorporate Michael's spirituality into his healing, and in a way into my healing with him, or my caregiving.
My perception is that Peter has unique gifts of spiritual healing in his presence that maybe he fully understands or maybe doesn't. But my experience has been that there's often a very sacred, powerful energy working through him that he's quite attentive to and responsive to. But that's not the way he talks about it, and my agenda isn't necessarily to get him to talk about it that way. But I want to recognize and celebrate that powerful healing role that he plays beyond the technical and beyond even the relational, but that the quality of his presence and attention, I think, invites a kind of sacred aspect to healing that is beyond how Peter describes himself.
That's wonderful to hear. I don't as Michael said, I may not recognize that, and I do not. I just try to be kind and present and thoughtful.
His honesty about, from the beginning, this is a serious diagnosis and your life might be a lot shorter. He's able to say that and talk with me about that in a way that felt different than many other doctors as they told me that, but in a way that kept pointing back to what's most important and how can you live most fully now. And that's been a part of the decisions about treatment options, and just helped me keep returning to that as I'm going through what might be difficult physically and emotional processes, knowing that together we're focused on that, not postponing joy, savoring life right now, has been really meaningful for me.
When I have young physicians in my clinic or medical students, the thing that I find that I have great hope for them to be a skillful clinician is when they're finding a way to love their patient. And love is such a loaded word, but I don't think that if you can't find a way to connect in your heart with them, that you can do the best. And sometimes loving patients is really hard.
That really summarizes my experience of being partnered in this health path with Peter, of feeling loved and feeling that love expressed through lots of care for helping me along the path.